Since the last video, I have had several questions being asked about women with irregular menstruation. It is common for women to have variation in the number of days in their cycle. Sometimes it could be 28, 27, 31, but these are still considered to have fallen within the normal range. An irregular menstrual cycle is one that is shorter than 21 days or longer than 35. It is possible to become pregnant when you have an irregular menstrual cycle, but you may find it difficult. If you're unsure about the length of your cycle, from 1 month to the next, it can be difficult to know when you are ovulating. Timing intercourse around ovulation can increase your chances of pregnancy, since you will need to have sex during your fertile window to conceive. That's a few days before your ovulation. An irregular menstrual cycle may also be a sign of irregular ovulation. You may not ovulate every month, or you may ovulate at different times from month to month. Please stay with me to learn more. Hello and welcome to the last part of the series, How to Calculate Ovulation Period. In today's video, we are going to be looking at ovulation and irregular period. I am Dr. Lukman Olushesi, your school doctor. We shall be breaking down the issue of irregular period into 4 parts. In the first instance, we'll look at ovulation and irregular period. Secondly, we look at the causes of irregular period. Thirdly, we will discuss how to monitor ovulation when menstruation is irregular. And lastly, we'll talk about when to see your doctor. There are 2 issues that are common features of irregular period. Firstly, you could have ovulation without menstruation. This makes tracking of ovulation difficult. Secondly, we could have menstruation without ovulation. This also makes the timing of ovulation difficult, and for women who are planning to get pregnant, it becomes difficult to time the period of ovulation with intercourse. In the life of a woman, if the average menstrual cycle is about 28 days, a woman is expected to ovulate 12 to 13 times in a year. For women with irregular period, this number of ovulation reduces. It may be reduced by as much as 50%, meaning that the woman is going to be ovulating 6 times in a year. And if this woman cannot even predict or time when this 6th ovulation would occur, then achieving pregnancy also becomes very difficult. How then can we have ovulation without menstruation? Usually when the uterus has a scar, it affects menstruation. The scar could be from cesarean delivery by cesarean section. The scar could come from D&C, dilatation and curettage, from abortion. There's something that we call over-enthusiastic curettage, in which the doctor is scraping and scraping and scraping the uterus to ensure that the product of conception is totally evacuated. This might leave a permanent scar inside the uterus. Also, we could have some uterine diseases, infection of the uterus that may end up with scarring of the uterus. All this can actually cause ovulation without being followed by menstrual flow. We can have menstruation without ovulation. This is called anovulation. The menstrual cycle is regulated by a delicate balance of hormones in a woman's body. As some hormones are rising, some are falling to ensure that the eggs mature and that the mature eggs are released in preparation for pregnancy. Whenever there is failure of this process, then there is a problem. Two things could result in a failure of ovulation. One, whenever there is disruption in the delicate balance of hormones that regulates ovulation. Or secondly, if there's a problem with the ovaries. So it is very, very important that we watch what we do, we watch what we take, we watch, how we live, especially if you are planning to achieve pregnancy. Some of the known causes of anovulation include the use of contraceptive pills. Of course, if you desire to have pregnancy, you cannot be on contraceptive pills, because what a birth control pill does is to stop ovulation. Secondly, the use of some certain drugs, for instance, the non-steroidal anti-inflammatory drugs, the ibuprofens, the felvins of this world that we use for pain, especially for joint pains and chronic pains, they have the capacity to also inhibit ovulation. There are some beauty products that contain hormones, these anti-aging products, that we apply to our skin to look young and beautiful. Some of the active ingredients of these products may be absorbed through the skin and affect ovulation. There's another condition that we call polycystic ovarian syndrome. This syndrome results in the excessive production of some hormones, right? The estrogens and male hormone that we call testosterone. It is when we have excessive production of these hormones that the young women in their late teens, 17, 18, 19-year-olds, will begin to battle with, excessive pimples, acne we call it. All right, the body hair would increase. They might even have irregularity in their menses. The menses could be coming, the cycle could get extended for over 35 days. This may happen temporarily in young people, and if it disrupts the menstrual cycle in such a way that achieving pregnancy becomes a problem, then that is one of the times that you need to see the doctor. Excessive weight gain, excessive weight loss, this would naturally affect the menstrual cycle and may result in anovulation. Premature menopause, when the ovary stops producing eggs before the age of 40, then that is a premature menopause, and it may require the intervention of a doctor, right? And of course, menopause is a reason for anovulation. Once you attain the age of menopause, the ovary is tired and it will stop producing egg altogether. In some women, the fear of gaining weight will push them into severe dieting, severe exercise. They will be so skinny. They just want to be very, very thin. In these women, we have issues of irregular periods, and it might be very, very difficult for this kind of women to eventually achieve pregnancy. Then high level of stress, whether emotional stress, psychological stress, especially if it is chronic, if it is groaning, it is there months after months, years after years, and we are just trying to live with it. It could result into disruption of a lot of hormones in the system, including the hormones that guides reproduction and ovulation. How then Can a woman with irregular menstrual cycle tracks ovulation? How then can a woman with irregular menstrual cycle plan for pregnancy? There are some bodily changes that occur during ovulation. One is ovulation pain. In some women, whenever they ovulate, they experience pain. It happens in about, say, 5% of women. It's not so common, right? So about 2 weeks before their next menstruation, they have pains in the lower abdomen. It could be on the right, it could be on the left. And it is usually common amongst young people, because they will keep coming to the clinic complaining of low abdominal pain. All right. Since this is not common in all women, then it may not be a very good indicator for ovulation, because you could have low abdominal pain from other causes. Raised body temperature. It is known that whenever a woman ovulates, there is an increase in basal body temperature of about 0.5 to 1 degree centigrade. So if you want to monitor your ovulation and you're having irregular cycle, you may want to get a thermometer and begin to check your temperature every morning. So whenever you have a spike or an increase in temperature, then it may be a pointer to the fact that you may be ovulating. However, this method too has its shortcomings. If you have fever, that method will not work. If you change where you are sleeping, that method will not work. If you change the environment, where you sleep, maybe you use AC and you sleep in a room that does not have AC, it may give you a false result. So, but the rise in body temperature is an indicator of ovulation if every other things remains constant. One of the best methods that could be used to track ovulation, especially in a woman with irregular period, is if you monitor the level of luteinizing hormone, because this particular hormone rises sharply just before ovulation, unlike the rise in body temperature that occurs after ovulation or during ovulation. All right, this luteinizing hormone rises sharply before ovulation. So there are kits, we call them ovulation kits, that you can use to monitor your level of luteinizing hormone. Every morning you dip the kit in your urine, you check the level of hormone, and you track. Whenever there is a sharp rise, then you know that ovulation is likely to follow. You can then plan for pregnancy. Then another thing that usually happens during ovulation is change in cervical mucus. The cervix secretes large quantity of mucus that is drawy in nature during ovulation. So you can check the nature of your vaginal discharge, coming from the cervix, and then whenever you have the longest sliming, it's colorless, it's odorless, it draws, then it will give you an idea that, okay, something is happening in my system. It could be ovulation. Then you can plan for pregnancy when this occurs. When then should you consider visiting your doctor? You have done your own bit possible to get the record of your cycle. You have monitored your basal body temperature for 3 months, or you have used the ovulation kit to monitor the level of your luteinizing hormone for 3 months, and despite all that, you have not achieved pregnancy. Or you have monitored your cervical mucus. Remember, the discharge is colorless, is odorless, it is drawy in nature, and when it draws the longest between two fingers, that is when you are most likely ovulating, and that is when you should plan intercourse if you want to achieve pregnancy. You have done all that repeatedly for 3 months, and you have not achieved any results. Yeah, at that time, you need to speak with a doctor. If you have not seen your period for more than 3 months, if you are bleeding heavily, if your period, which does not come with pain or comes with mild pain, suddenly becomes very painful, or you have been trying to unsuccessfully get pregnant for more than 1 year, you want to speak with the doctor.